Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the sites of portosystemic anastomosis, also called portocaval anastomosis. So this is the anastomosis, the connection between two blood vessels. So the portosystemic anastomosis is the anastomosis between the portal vein or its tributaries, portal vein tributaries, and the systemic vein tributaries. Systemic vein tributaries. Okay, it is the communication anastomosis between the portal vein and the systemic vein. The systemic veins are the superior vena cava and inferior vena cava. Systemic veins are the superior vena cava and inferior vena cava. Okay, and portal vein is a vein that collects nutrition rich blood to the liver. This is the portal vein formed by the union of the superior mesenteric vein and the splenic vein. Okay, so this is the portal vein that is formed by the union of the splenic vein. Here it is splenic vein, and this is the superior mesenteric vein. This is the superior mesenteric vein, superior mesenteric vein. Okay, so here is the formation, and this is the portal vein, this is the splenic vein, this is the spleen. Okay, this is liver, and this is the inferior vena cava, superior vena cava. This is the azygous vein, hemiazygous vein. Okay, so there will be establishment of anastomosis between the portal vein and the systemic vein. Those are the tributaries of inferior vena cava or superior vena cava. So it is called portosystemic anastomosis, also called portocaval anastomosis. Both of them are correct. Okay, we got that. Now, why this happened? Why there is establishment of portosystemic anastomosis? Okay, so portocaval or portosystemic anastomosis is established when there is high pressure in the portal vein. Okay, this happens when there is liver cirrhosis, liver cancer. So the liver architecture is distorted, that will compress on the portal vein. So portal vein is compromised, pressure will be high. So after the nutrition rich and and also the undigested or semi-digested product before metabolism going to the liver. So these are carried from the GI tract to the liver by the portal vein from GI tract, and this blood is rich in nutrition but poor in oxygen. They also contain some toxic substances that need to be metabolized in the liver. Okay, so after metabolism, the blood should return back to the inferior vena cava by means of hepatic veins. Okay, hepatic veins. So hepatic vein, blood from the liver go to the inferior vena cava. But if there is high pressure in the portal venous system, what will happen? The portal vein pressure will be high. The blood returning to the inferior vena cava by the hepatic vein will be decreased, and there will be establishment of anastomosis between the tributaries of portal vein with that of the vena caval tributaries. So that will be established because of high pressure in the portal system. Because high pressure in portal system, low pressure in the systemic vein, so there will be establishment of portocaval anastomosis. Okay, so that blood will return back to the right atrium of the heart. Okay, so that is the idea. So most common cause is cirrhosis of liver, maybe due to liver cancer that may happen. So we have to find out what are the sites of portosystemic anastomosis. Sites of portosystemic anastomosis. Portosystemic, or we can call portocaval anastomosis. Portocaval anastomosis. Number one is the esophagus. Lower part of esophagus. Lower part of the esophagus. Lower part of the esophagus gets its venous drainage by means of the left gastric vein here. So this is the anastomosis between the left gastric vein. Left gastric vein is a tributary of the portal vein. Tributary of portal vein. Okay, this will anastomose with the esophageal veins of this will anastomose. This will anastomose with the anastomose with the esophageal veins. These are derived from the, or we can say these are the tributaries of azygous vein, and hemiazygous vein. Hemiazygous vein. So here this happened along the lower part of the esophagus. We have the left gastric vein that is a tributary of the portal vein. It will anastomose with the vein, esophageal vein. These are the tributaries of the azygous vein or hemiazygous vein. Okay, these are the esophageal veins. This is the left gastric vein. So they will anastomose, and what will happen? There will be establishment of anastomosis, and there will be engorgement of the submucosal veins in the esophagus. Okay, so there will be varicosity, or engorgement of submucosal venous sinuses in the esophagus. We call it esophageal varices. Esophageal varices. So this is the establishment of anastomosis, because blood cannot go through the hepatic vein. There is high pressure there, so it will go back to the heart by means of these anastomotic channels. Okay, so we got the esophageal varices, and these may be ruptured, and there may be very much severe hemorrhage. We call it, it may rupture. Okay, that rupture may lead to vomiting of blood, and we call it hematemesis. And that may be very much catastrophic or fatal sometimes. Too much blood may be vomiting out. Okay, so we got one side. There is the esophagus that lead to hematemesis or vomiting of blood due to rupture of the esophageal varices. So we got one esophagus. Our second side is the around the umbilicus. Our third side is the anal canal area. Anal canal. Fourth side of portosystemic anastomosis is the retroperitoneal spaces, okay, of the colon and duodenum, duodenum, and bare area of the liver, and the bare area of the liver, bare area of the liver. So this is the side number 4. We can add few more, okay, like that. Sometimes some people may have patent ductus venosus, rare but possible. Patent ductus venosus, that may be possibility. There may be some type of anastomosis between the splenic vein with renal vein that may be established in case of portal hypertension by the surgeon. It may be iatrogenic, okay, or it may be done by the surgeon due to some indication to manage portal hypertension, or even there may be portosystemic anastomosis, posterior wall of the vagina, That is also possible between the rectal vein and the vaginal vein. Okay, so we'll start only one. We have just covered the esophagus. Then we'll go to other sides like that of around the umbilicus. Okay, suppose this is the umbilicus. Here the systemic vein are the epigastric veins, superficial epigastric vein, intercostal veins, lateral thoracic veins. Okay, so we have systemic veins. What are those? These are the superficial epigastric, lateral thoracic, inferior epigastric, they will anastomose with that of the para-umbilical vein. Para-umbilical vein, umbilical vein. Okay, so this is the portal vein tributary. Okay, that is portal vein tributary. That is tributary of the left branch of the portal vein. Okay, portal vein tributary. These are the systemic vein tributaries. Okay, vein tributaries. Okay, so there will be anastomosis around the umbilicus between the systemic veins or caval veins and the portal vein. So that is around the umbilicus, and para-umbilical vein passes along with the ligamentum teres hepatis or round ligament of the liver, okay, to the left branch of the portal vein. Okay, we got that. Now we got another one around the umbilicus, and we have very interesting point is here. Okay, it is also called Caput medusae. Okay, according to Greek mythology, okay, from the head of some god, some serpentine appearance or snake is coming out of the head, okay, like that. Okay, that is called Caput medusae. Okay, that happen on the around the umbilicus under the skin. Okay, that happen due to portal hypertension. Okay, blood is returning back because there is some high pressure here, returning back through the systemic vein to the caval system. We got the number 2 spot. This is number 2. Esophagus, number 1. We have esophageal varices here. We just discussed number 1, number 2. Now we'll go to the anal canal, number 3. Anal canal. Okay. Anal canal, what happened? Superior. Okay. So anal canal, our third side. Okay. What is the portal vein here? Portal vein tributary. Portal vein is the superior rectal vein. Portal vein tributary. Okay, superior rectal vein. We know that superior rectal vein will continue as the inferior mesenteric vein, and this is the inferior mesenteric vein here. Inferior mesenteric vein. Inferior mesenteric vein will open into the splenic vein, and splenic vein and the superior mesenteric vein will form the portal vein. So this is superior rectal vein is a portal vein. Okay, the portal vein, it will anastomose with that of the middle rectal vein. Middle rectal vein, that is a tributary of the internal iliac vein, and the inferior rectal vein, that is a tributary of the inferior rectal vein, that is another tributary of the systemic system. Okay, so middle rectal vein is tributary of internal iliac vein. Inferior rectal vein is also a tributary of the caval or systemic circulation. It is tributary of the internal pudendal vein, maybe. Okay, from the internal pudendal vein. So these are the systemic vein. Okay, or caval vein or systemic vein. Caval vein or systemic vein. Okay, so this is a tributary of the internal iliac vein. This is a tributary of the internal pudendal vein. Okay, this is systemic or caval. Okay, So that is another site of anastomosis in the anal canal. Okay, so there is engorgement of the blood vessel, of the blood, venous blood there. There will be varicosity in the vein that may lead to hemorrhoid or piles there due to portal hypertension. Hemorrhoid or piles. Okay, we got the third site. Okay, now we'll go to the fourth site. That is in the, suppose this is the descending colon. Okay, colon, descending colon, descending colon. So descending colon is venous drainage by means of the inferior mesenteric vein. This is the inferior mesenteric vein, here inferior mesenteric vein, and also on the posterior wall it is getting the venous blood is also, it is getting venous blood, or venous blood is drained by the lumbar vein here, lumbar vein here. Okay, so lumbar vein is a systemic vein. It opens in the inferior vena cava. It is a caval system, and inferior mesenteric vein is a portal system. So we'll say the retroperitoneal space, retroperitoneal space of the colon and duodenum. Okay, so these are secondarily retroperitonized. Okay, secondarily retroperitonized. Okay, so what happened in subdescending colon? We have the systemic vein is the lumbar vein, that is systemic or caval. There is a tributary of the inferior vena cava, and it will anastomose with the inferior mesenteric vein, the colic branch of the inferior mesenteric vein. Okay, colic tributary of inferior mesenteric vein, inferior mesenteric vein. Okay, so we got another. In the duodenum, we'll also get the get the vein on the posterior wall of the upper part of the abdomen. Will anastomose with that of the portal vein tributary, like the tributary of the portal vein which supplies the duodenum. It will anastomose with that of the vein on the posterior wall of the abdomen. Okay, so we got the site of anastomosis, that is the third site. Okay, actually fourth site. Okay, fourth site. Okay. Now we'll find out a few more things. Okay, so we'll find out a few more things like that of the patent ductus venosus. This doesn't happen usually, but on rare occasion, the ductus venosus connects the left branch of the portal vein to the inferior vena cava directly. So this is another site, maybe the fifth site. Okay, fifth site, that is possibility here. Okay, so that is one, patent ductus venosus, that connects the left branch of portal vein to the inferior vena cava directly. So that may be connection here. We got that. Now we got the fifth one, and we may have connection between the splenic vein and the renal vein. And the renal vein, there may be connection between the splenic vein and renal vein. Okay, so that may be the sixth one, connection between the renal vein with the splenic vein. Sometimes it is done by the surgeon to to manage a patient of severe portal hypertension, splenic vein. Okay, that may happen. Or in the seventh side, the anastomosis. Connection means anastomosis, better to say anastomosis. Anastomosis. Anastomosis between the superior rectal vein plus the vaginal vein. This is a tributary of the internal iliac vein, and also from the internal pudendal vein. Okay, so we got that. So this is that's all about the location of the portosystemic anastomosis. Idea is that portal vein carry oxygenated blood. This blood also contains some toxic substances that should be metabolized and detoxified in the liver. They should return back by the hepatic vein. For any reason it is compressed, then there will be establishment of portosystemic anastomosis. So sometimes physician make connection between the portal vein and the inferior vena cava, or the splenic vein to the renal vein. That may do to manage the portal hypertension, but whatever it may be, because the portal vein blood should be detoxified in the liver. If it is not detoxified, if it is going to the systemic circulation, then our body will contain too much toxic substance, and someone may develop hepatic encephalopathy in the late stage of cirrhosis of liver or in portal hypertension. That's all about the portal hypertension plus the sites of portosystemic anastomosis and the anastomosis between what vessel with what vessel. We have just discussed that. So if you have any question, please feel free to ask me, and please support my channel. Please subscribe me, and have a nice day. Bye now.